Back pain is metaphorically a headache to the healthcare system worldwide. Do you know the World Health Organization describes this condition as one with the single leading cause of disability worldwide? As a matter of fact, in developed countries, it's the most common cause of sickness related absence from work. Back pain affects quality of life as well as mental well being, limiting activities involving personal and social engagements. Hi, I'm Dr. Francisca Osage. Thank you for joining me on Francisca on Health Matters. Before delving into this topic, let's take a quick look at the anatomy of that part of the body that plays a significant role to this condition, the backbone. Now, there's what we call vertebrae. These are bony structures, and they are 33 in number. They stack on one another, separated by what is called an intervertebral disc. The intervertebral disc is made up of a gelatinous substance in its core or center, surrounded by a fibrous cartilage. Now, supporting these structures are what we call ligaments and muscles, which actually form the core of the body. The muscles are inserted onto the bones via what is called tendons. Now, the bones that stack on one another, supported by these structures, form what is called the vertebral column. And in the center of the vertebral column is the spinal cord. Emerging from the spinal cord are spinal nerves, which distribute to various parts of the body. So, in summary, there are bones, ligaments, tendons, muscles, and the neural components consisting the spinal cord and emerging nerves. And the majority of the causes of back pain will arise from strain, injury, or disease processes involving these components. However, pain can also originate from tissues and organs located away from these structures due to the nerve supply. And when disease processes involve these structures, there's going to be pain transmitted to the back. This is called referred pain. Examples of such conditions involve the kidney, as in pyelonephritis, polycystic kidney disease, kidney stones. We have conditions affecting the ovary, like ovarian cyst, or other gynecological problems like in endometriosis. We have the peptic ulcers affecting the bowel, the pancreas, we have acute pancreatitis, you have shingles, herpes zoster. Now, the pain arising from this condition can be ameliorated when the condition itself is addressed. Now, going back to the category, which is said to be the most source for pain, that is the category involving the vertebrae and the associated components. The majority of causes of pain arising from these structures are going to be by way of strain, sprain, stretch, or injury involving these structures. Usually, these are done during action involving the muscles, tendons, and ligaments. It could be as a result of excessive weight bearing, a twist, a bend, or fall. Now, there are certain factors that could make one easily predisposed to having these kind of injuries, and such as being overweight, involving in prolonged sitting, or maintaining poor posture. In summary, to reduce this risk, don't forget the benefits of weight loss if one has excessive weight, taking regular exercises, and maintaining good posture. This will involve bending at the knee and not the waist, taking walks and breaks to avoid prolonged sitting, and also when in the sitting posture, sitting with your back against the chair's back. Now, for the next category of pain, that is the category involving the disease processes affecting the vertebra and the associated components. I would like to further categorize these disease processes into classes of degeneration or degenerative processes, inflammatory processes, metabolic processes, and neoplastic processes. Now, I'm going to mention terms, however, don't be dissuaded. I will try as much as possible to really make this easy. So for the degenerative processes, these involve processes that involve aging. So you have terms such as disc degeneration, disc bulging or prolapse, lumbar spondylolysis, or lumbar spondylolisthesis. These processes involve degeneration of the parts of the vertebrae or the ligaments associated with them, right? There's also osteoporosis that could eventually cause compression fracture. These all are as a result of degeneration of these parts. Now, the next category, that of inflammation, Pretty much it involves processes that could ultimately lead to some form of arthritis involving the vertebral bones. These arthritic processes can further complicate into conditions such as spinal stenosis. In spinal stenosis, that's column, the canal through which the spinal cord is transmitted through, becomes narrowed as a result of arthritic processes, right? There's also the foramina, a part of the vertebra through which the spinal nerves emerge to distribute to other parts of the body. These foramina could also get arthritic, and in the process, the channel through which the emerging nerves come out through becomes reduced, so it pinches the nerve. These ultimately will cause pain of some sort, right? So these are inflammatory causes. Then I talked about the metabolic processes. Metabolic processes will involve some form of hormonal dysregulation, right? So you have conditions such as osteomalacia, even osteoporosis, conditions involving the hormone parathyroid hormone, which pretty much helps in regulating calcium and vitamin D metabolism. This could ultimately lead to some form of processes that could cause back pain. And for neoplasm, neoplasm means tumor formation. Now, tumors could be either benign or cancerous, right? When you say benign, it is not cancerous, right? And for the cancerous, it could be primarily in the bone, originating from the bone or from a distal part, and which has now gotten into the bone or metastasized to the bone. Right? We have primary tumors involving the bone, or a secondary which has metastasized. Common sites for these will be the breasts, the lung. So breast cancers, lung cancers, and prostate cancers, they could eventually metastasize to the bone and cause back pain, right? So these are disease processes that involve these components that manifest with back pain. Now, pain as a result of these conditions are usually progressive and chronic in nature, and the intensity of pain can be affected by movement and or posture. Now, to make a definitive diagnosis, there's certain imaging that become necessary, such as CT scan, MRI, and or X-ray. Lab investigations will also become necessary for blood work and urine sample collection. The pain may or may not be amenable to surgery. However, pain medications might be very, very beneficial. Also, there will be the benefit of physical therapy, right, in addressing these pain conditions. Now, with the occurrence of back pain, pay attention to these red flag warnings that should make you urgently seek the attention of a physician. Number one, history of fever and or night sweats. 2, numbness around genitals. 3, history of loss of bladder or bowel control. 4, history of intravenous use or immunocompromised status. 5, history of trauma. 6, history of cancer or weight loss. Now, it is estimated that about 3/4 of all individuals will sometime in their life experience back pain, and so the prevalence is relatively high. There are certain habits we can instill that could reduce these factors. Now, what are these habits? Number one, engaging in physical activity. Number two, eating right, having a balanced diet infused with vitamins and minerals. Number three, avoid smoking tobacco. 4, maintaining a healthy body weight. 5, getting a good sleep. And 6, practicing or maintaining good postural habits. And this will include instances like when bending, flexing at the knee, not the waist, while keeping the back straight. And also at the workplace, having or making ergonomic adjustments. Now, I'm sure if these are applied, they can go a long way in reducing certain risk factors that could predispose to having back pains. Again, I hope you found this informative and educative. And if you've had, please subscribe, and I'll see you in the next one.